Now to a health alert, routine checkups with a gynecologist may no longer include the pelvic exam. A large group of doctors with the American College of Physicians is recommending against the practice of pelvic exams, saying it may do more harm than good. Dr. Dudley Brown is an OBGYN at Good Samaritan Medical Center, joining us to talk about this. Doctor, appreciate you being here. You've looked at the study. What do you think?
Well, I've seen the recommendations, right, because they just came out today in the Annals of Internal Medicine. And basically what the American College of Physicians is saying is women don't need to get an annual pelvic exam, which has been a long-held practice, especially in gynecology. They're saying that the exam is not as good as originally thought in detecting disease or illness, that it causes anxiety because it's an invasive test, and it leads to unnecessary testing because of false positives. And that's what the summary is from them based on that recommendation on.
But you're in the other school of doctors who are saying, well, even if it catches something in one woman, isn't it worth it?
Exactly. So the American College of Obstetricians and Gynecologists, ACOG, the body to which I belong, have a long-standing recommendation for an annual pelvic exam. We certainly understand that the exam is flawed. It is not perfect at picking up certain diseases, and it causes anxiety for sure. It's invasive, and no one really enjoys it. No patient enjoys it. No physician enjoys it, but it's necessary. And it does detect abnormalities that may be asymptomatic. For example, some women may have fibroids, ovarian cysts, heaven forbid, ovarian cancer, and this exam can detect that. Some genital tract lesions, vaginal cancer, they're very rare, but the pelvic exam can detect those things. And so for now, anyway, our recommendation is to still do an annual pelvic exam.
And when you pair this with, in 2012, there was a recommendation that came out and said if you're healthy, you may not need a pap smear every year. You may need it every 3 years.
It's all very confusing for patients to follow. Because even when those recommendations came out, we saw the science and the value in what they were saying. However, we were saying doing a pelvic exam every year, except every 3 years we take the pap specimen. And a lot of women don't know the difference between a pap smear and a pelvic exam because they're not the same thing. The take-home point is, my recommendation is, you still need an annual pelvic exam because even though it's flawed, we still think that there's great value in it.
If it were me and they found something, I'd be continuing with them every year, absolutely. Dr. Dudley Brown, thank you very much. Women, talk over this, all of this with your doctor, and you can make your own decision. We appreciate it.
Thank you.
Michael?
Thank you both.